We're following new details on the latest Ebola crisis to hit the Democratic Republic of Congo. 3 Ebola patients escaped quarantine in the African nation, and health officials say 2 of them have died. The 3rd patient is under observation. There's nearly 30 confirmed cases in the country right now and more than 20 possible cases. Dozens of people have already died from this new outbreak. Major vaccination efforts are underway across the Congo, and health workers who are especially at risk are trying to contain the crisis by making sure they get vaccinated to start with. For more on this now, we want to bring in CBS News foreign correspondent Debora Patta. She's been following the story very closely for us. So, Debora, this is the first time vaccines have been used to fight a new Ebola outbreak, but the death toll keeps rising. So what is the latest on the efforts to treat and contain this virus?
And Marie, let's just be clear, the vaccine cannot cure Ebola. So what the vaccine does is it prevents the spread of Ebola. And that really is the critical thing here, is that what health organizations are trying to do is stop this particular outbreak, the 9th in the Democratic Republic of Congo, from spreading further. It began in Bikoro. Worryingly, it spread to Mbandaka, a port city of over 1 million where people move in and out. Previous outbreaks have been contained in rural, remote areas. So that is cause for alarm. And the fact that these 2 people who were quarantined in Mbandaka escaped. So what they will be doing is first vaccinating the health workers, then moving to those who have come into contact with people who are suffering from Ebola or have contracted the disease and trying to vaccinate them. And then also traditional education processes are going on. We've seen young children talk about how they have to wave. They can't shake hands when they greet people. They must remind their mothers to wash their hands when they cook. They themselves must wash their hands. These all become crucial parts of containing this particular outbreak. Mobile labs have been set up, and health organizations have been very quick to respond this time.
So what are some of the biggest challenges the Congo and neighboring countries face when it comes to keeping this outbreak contained?
Well, the DRC and its neighbors are very poor, and I think poverty is one of the biggest challenges. In the Congo alone, for example, only about 20% of the population have access to proper health care. They can't just pop into a clinic like, for example, in the US and get health care. They have to often walk for miles on end. Let's take Bikoro, the epicenter of this disease. It's only 500 miles from the capital of Kinshasa, but it can take several days, 4 river crossings included in that time, to actually reach this little village. Even in Mbandaka, the port city, is several hours away from Bikoro, and if the rains are bad, it could take up to 4 days to get to and from this area. So geography and poverty are serious concerns in trying to contain this particular outbreak.
We are still talking about, I guess, a handful of cases. The number's growing, but at least, you know, it's not hundreds of people right now. Does that mean that if there's widespread distribution of this vaccination, perhaps a major Ebola outbreak could be contained, that we won't see what we saw in 2014?
Anne-Marie, that's certainly the hope, and the words that are being used are this vaccine could be a game changer. In fact, what people are saying, what health officials are saying, is that it's a paradigm shift. It's not just containment. They're now actually able to offer proper protection and proper care to people who may have come into contact with people suffering from Ebola. So this will radically change the way the disease is dealt with this time and perhaps well into the future. Trials of the vaccine in Guinea and Sierra Leone at the end of the last outbreak were very successful. So hopes are very high that this vaccine will contain this particular outbreak. There's still concerns. Once you have the vaccine, it takes between about 7 to 10 days for it actually to start protecting a person. So traditional safety protocols still have to be followed, washing hands and all the security regulations that go with that. And also storing the vaccine. It has to be stored at very cold temperatures. Remember, the DRC is a tropical hot climate with very patchy electricity. So these become major issues in having to deal with this particular outbreak. But certainly there is great hope riding on this particular vaccine and what its consequences will be for this outbreak and any possible outbreaks in the future.
You know, here's the thing, just to add to the challenge, Deborah, the first time you told us about this outbreak, when it had just started in this remote village, it was around the same time that the U.S. Released a proposal to cut all Ebola funding. Same day it happened. I'm wondering what sort of impact something like that would have. You know, how much does the DRC rely on American funding and humanitarian aid to fight a crisis like this?
Well, as we mentioned, Anne-Marie, the DRC is a very poor country. It is rich in minerals. It should be one of the richest countries in Africa, but it is right at the bottom of the scale because of conflict and because of corruption. It needs financial aid. And containing Ebola is a very, very expensive business because of the treatment, because of all the equipment, the protection, the suits, the things that one needs at one's disposal in order to prevent this outbreak from becoming a global concern. And that's why we should all be concerned about this, because as we saw in 2014, it wasn't just restricted to Africa, it became an international concern. So already the World Health Organization and the United Nations have put significant funds aside to deal with this outbreak, but it's not enough. They need more. And the fact that there is this global health funding crisis with the United States cutting back, and we've seen the Center for Disease Control already curtailing the way it works in countries, and amongst those countries are places like the DRC and Sierra Leone. Sierra Leone was one of the hardest hit in the 2014 outbreak. So obviously this is of serious concern, and we've seen organizations like the UN and the World Health Organization saying they need funding, they need it fast.
Debora Patta, thank you so much for bringing us up to speed on this incredibly sad and concerning story.